Hi, everybody. I wanted to come to you by video to talk about whatever you guys wanted. I'm really excited to restart this project that I had started like a couple of years ago, and I kind of had to stop. But I think it's a great way to communicate with my patients and with anybody else that's interested. I'll be looking forward to getting your questions, your comments. I want to know what you guys want me to talk about from a pediatric perspective in the community. I'm open to any subject. So that's that. And I really, I'm looking forward to you sharing my posts, to you commenting on my post, liking my post, and I hope this turns into a great project for everybody of educating the community, educating patients at the comfort of your home and probably your cell phone. I don't have anything scripted or planned. I just wanted to talk about fevers. A lot of patients worry about fevers, and I want to kind of go through some of the basic principles. The fever is anything above 100.4, and the best way to check it is rectal. Of course, that's a lot better said or done in a baby than an older kid, but that's the definition of fever, 100.4 or more. Now, a significant fever for a baby that's over 3 months of age is anything above 102.2. That is a significant fever. Now, of course, they have a fever if they have 100.5, but it's not really concerning significant by in itself until it gets to 102.2. Another criteria is that if the fever lasts more than 2 days. That's kind of like even if it's 100.5, 100.8, and it goes on for more than 2 days, then that's probably worth checking with your doctor. And that's as far as fever, because I do notice a lot of patients get worried about the fever. I'm not talking about anything else that goes on. And let me explain what I mean by that. If you don't have a fever, but your child doesn't want to eat anything at all, that is concerning as it is. Or if they don't have a high fever, it's 100.5, but they're breathing heavy, that is concerning. So again, when it comes to the fever itself, 100.5 and up is a fever. 102.2 or higher is a worthwhile fever to take a look at, or a fever that lasts more than 2 days, or any fever whatsoever that is associated with other concerning symptoms. Okay? Now, of course, age matters a lot. If you notice, I said 3 months and above, because any fever in a baby less than 3 months is worth checking with your doctor. It might be related to an infection that can be serious. And needless to say, if the baby is less than a month, that almost always requires hospitalization. So keep that in mind. Now, I'm sure I'm leaving a lot of questions out, a lot of details. I don't know if I was clear on my explanation. So that's where I really want you guys to kind of give me some feedback and allow me to explain further. I'm happy to do this. I love talking to my patients, explaining things to them, and I want to come across very accessible to you all. And I am waiting for your comments. Remember to share the video. I want this to be distributed throughout the Valley, or Texas for that matter. I really want to educate as many people as I can get to. And the best way to do it is going to be by you sharing the post, but also by you asking questions, asking me to clarify any subject that you're interested in. All right, guys, I'm really excited for this. I hope it does interest you as well. And I look forward to talking to you some more. You all take care.